I think this is a real breakthrough. This is a real leap forward in just how we treat surgical patients, how we deal with surgical pain.
It's what surgical patients have been waiting for years.
You know, it's been 100 years since we've had probably any significant new advancement, and just the idea that we can block the pain for a longer period of time after surgery is a huge benefit to patients.
Meet Dr. Richard Baxter, a plastic surgeon in Seattle, Washington. He's talking about a revolutionary medication that provides prolonged pain relief to surgical patients. The new medication is called Exparel. It works the same way other local anesthetics do. The difference is it lasts a few days instead of a few hours.
During surgery, toward the end of the operation, we inject it into the area, and then it just slowly releases there over several days. I use it a lot in abdominoplasty in particular, as part of a Mommy Makeover. That's made a big difference for those patients. I use it for breast augmentation patients and a lot of revision breast surgery.
Baxter says it helps patients get through the pain they experience in the first few critical days following surgery. One of his recent breast revision patients is Kathy Smith. She's been through breast reconstruction surgery not once, but twice.
In my mid-20s, I was diagnosed with breast cancer. I'd found a lump and went in, and it was shocking. I was numb through the majority of it and went through a mastectomy with reconstruction. Then 21 years later, I was diagnosed with breast cancer for a second time.
On her second go-around with breast reconstruction, Kathy says the difference was like night and day, thanks to new developments in technology.
The first surgery, I was in the hospital for 5 days. And the second surgery, I was in for 2 days.
Oh, the patients love it. Just the idea that they feel good. I call them up in the evening and, they answer the phone themselves and because they're up and having dinner and feeling pretty good.
Baxter says this new medicine can often diminish the need for narcotics altogether.
The side effects for narcotic medications include things like nausea, vomiting, just mental side effects. People don't like the way it makes them feel. Just this long list of things that if you can avoid those, it's a real benefit.
Getting back to work faster, being able to get out and socialize quicker, it made a huge difference in my recovery.
If someone was afraid and putting it off, what would you say to them?
If they were afraid because of the discomfort or the pain of it, I would say that's a temporary, minimal part of it, not to be afraid of that.